3 non-nutritional habits that will guarantee that you will have braces, and you will need to have braces no matter what. I'm Dr. Olga Dolghier here at Small Valley Pediatric Dentistry and Orthodontics. I'm board-certified pediatric dentist and laser dentist. So what are non-nutritional habits? Are they normal or not normal? What am I talking about? Number one is non-nutritional sucking. Your thumb sucking, your pacifier sucking, your finger sucking, and nail biting. All of this considered non-nutritional habits. What happens if you or your kid used to suck their thumb? They actually thumb shape the palate of your child's mouth or your mouth, because we see sometimes thumb sucking habits in adults. So what happens? The upper jaw becomes narrow. The front teeth are flaring out. So you have this type of appearance that your teeth are forward and you actually cannot bite down. Your back teeth most likely are touching, but your front teeth are not. A lot of times we develop open bite, or sometimes we develop back teeth cross bite. All of this contribute because of non-nutritional habits. Second one is your bruxism. Bruxism or grinding or clenching your teeth. This one is related to stress. A lot of times we see kids who completely grind their teeth to the ground, or adults suffering from grinding, snoring, tossing and turning. Kids actually can bedwet for a long period of time, not because of grinding, but because of airway obstruction, because it's all interrelated. If you grind your teeth, sometimes you have big tonsils and adenoids. You cannot sleep well. You are stuck in that light sleep instead of being in deep REM sleep. And as a result, you grind your teeth, kids can bedwet, they cannot sleep well. Adults are sleepy and tired all day, they cannot perform tasks, they lose attention. Surprisingly, attention deficit disorder is related to sleep a lot of times. People who cannot sleep well cannot concentrate well. And it's back to your teeth, grinding back to your airways. So it's all one big complex. Also, third one is the tongue thrust. So the kid who, for example, used pacifier until the age of 5, create a big open bite. Now they don't know how to swallow right. Surprisingly, at the age of 5, you might have infant swallowing pattern. What it is, it means that they push the tongue forward. They swallow like this. Your tongue should be behind your front teeth, but if there is no front teeth up front, what are they doing? They're sticking the tongue forward. And when they're at rest, they put the tongue in between upper and lower arch of teeth, so it's resting in between teeth, so it makes that open bite worse. So tongue thrust actually very, very difficult to fight, because it's already developed, and the kid already, every time they swallow, and they swallow so many times a day, they constantly push their tongue forward. So if you see your child sucking on something, or you as an adult trying to put things in your mouth, biting on nails, sucking on those pencils. I know some adults actually grind the pencils down like beavers. And that's considered non-nutritional habit as well. What can we do? Number one, behavioral modification. You have to see if your child does have bruxism. Do they have a source of stress? Is your child not breathing well? Do they have airway obstruction? Or what exactly causing this problem? So you have to dig deeper. You have to find out the cause, and then if you found the cause, you can treat the result of this problem. So behavioral modification is number one. Number two, we can actually do different type of appliances. We can have thumb crib appliance, which actually goes on your back teeth and prevents the, for example, 8-year-old from sticking the thumb in. On adults, sometimes we put braces on and put little spikes on the back of the front teeth to kind of make sure the tongue goes back and does not rest on the front teeth because it's uncomfortable. So we put spikes, literally spikes in the mouth to put the tongue in the proper position. A new emerging field is myofunctional therapy. It's like a physical therapy, but for your mouth. You're all familiar with physical therapy. If you have an injury, you have to go through rehabilitation. So now we have this great subspecialty myofunctional therapy, which trains the child how to position the tongue properly, why the tongue is not positioned properly. We actually assess and see maybe nutritional habits are due to something else. For example, extreme tongue ties. Sometimes we look at the child's mouth and he literally lifts the tongue up like about 1 inch from the floor of the mouth. The tongue should be resting on the roof of the mouth. And if the tongue is tight, they're losing range of motions. They're moving their tongue back and forth. They cannot lift the tongue up. And that might be creating nutritional habits. So it's all, again, big picture. You have to dig in. You have to figure it out. Myofunctional therapy, really great help. Sometimes we work with myofascial therapists and release the tongue tie or teach the child how to swallow properly. After this is all done, we would put, for example, braces on and close that bite down. Because if we did not find the problem, the source of the problem, what happens, for example, in adults, if we didn't figure it out why the bite is open, we will put braces on. They will close the bite, but temporarily. As soon as we take braces off, guess what? That bite will open up again because we did not find the source of the initial problem and we didn't solve the problem properly. So that's my non-nutritional habits. Share with me. Does your kid suck their thumb? What do you do for it? Don't let those kids suck on pacifier beyond 18 months time frame. And share with me. Let me know if you like these videos. Can't wait to see you again. Thank you so much for watching.